On today's show, I'm talking with Pete Waddingham, the National Net Zero Lead at the Health Innovation Network. Pete works with organisations across the UK to find innovative solutions that help the health service become more sustainable, more green, and achieve that net zero status. Hopefully, this has a knock-on effect to patient outcomes, patient healthcare, and hopefully even raises local economies. But why? Why are these things connected? Why should the health service be more sustainable? What does this mean for patients? How does this improve the overall health service? That's what we're discussing today. This is Shifting Views with Willis. Okay, Pete, welcome to the show.
Thank you.
Health Innovation Network and National Net Zero Lead.
Yeah.
They sound like quite fancy titles.
Yeah.
What does all this mean?
Good. Okay. Well, I'll start with what the Health Innovation Network is.
Yeah.
So we're actually a network of networks. So there are 15 health innovation organisations in England. They're all geographically tied to their local area. So, for example, there's one in Yorkshire and Humber. There's ones in London, South West, North East, North West. So there's 15 of us, and we're a network of networks. But our job is to try and find and spread innovation amongst the NHS on lots of different areas, from cardiovascular disease, respiratory, patient safety, medicine safety, etc. I'm obviously involved in net zero. I've been involved in lots of other areas in the 7 years that I've been working with the Health Innovation Network. But yeah, I work on net zero. So we're trying to find things that can obviously help the NHS on its ambitions to be net zero. But actually that can be things like improving patient care, which we know has a net zero benefit. But yeah, we're a network of network, and our job is to find innovation, spread it, work with innovators, support them on their journey, help them. A phrase that I really like is navigating the nuances of the NHS. So we help them navigate the nuances of the NHS, which is not an easy task, but that's what we're here to do.
It sounds like the coolest job in the world, because essentially you get to go and ride around the country and look for like cool innovations.
Yeah.
And I've seen some of your videos that you put out on social media, and I saw one the other day where you was with like a living wall, a green wall.
Yeah.
Talking about making, which I'm totally all for. I'm
Yeah.
such an advocate of green cities.
Yeah, me too.
And I think it always looks a lot prettier, even if you've got steel and concrete and glass.
Yeah, absolutely.
You just put some green stuff around that, build it into the buildings. It transforms it completely.
Yeah.
But also there's a benefit to the area.
Yeah, absolutely. Well, firstly, I don't ride around the country that much, just purely from a net zero perspective.
just from the boss's perspective.
Only because, I'm lucky in this kind of more modern world.
Yeah.
Obviously, since COVID, we are digital by default, and I do work from home. But every now and then I will have to travel to places like London, which is brilliant. It does get me out of the home and get to meet and collaborate with brilliant people. But yeah, we try and find innovation. We have a lot of companies, as I say, working in many different areas. I'm trying to look for net zero innovation, but as I said, that doesn't mean necessarily that its primary aim is net zero. So, for example, it could be a digital platform that's going to improve patient pathways, prevent them from hospital admissions, prevent them from travelling to hospital for their diagnostic tests. So how can we manage people in the comfort of their own home, using less resources? But obviously, I'm also interested in what those primary net zero innovations could be. So, for example, we've got companies that are doing reusable PPE. Obviously, they're trying to displace the masses of single-use PPE that's used in the healthcare system.
Sure. Yeah.
Medical reprocessing of equipment. So again, how can we make that medical equipment last a bit longer, reuse it rather than be single-use, throw it, put it into incineration. So I kind of put innovation into those kind of two camps: primary net zero innovation and net zero that could have innovation that could have a net zero secondary benefit.
Do you know what I think the problem is in a little bit of this is when it comes to sustainability and net zero, it's really hard to resonate with the everyday person, because it sounds quite fluffy, doesn't it?
Yeah.
And it sounds quite out there and climate change and all. And that's kind of that apathy type vibe. But in a tangible sense, I'm just thinking we're all users of the health service. So if you're a patient listening to this, why is it so important? Why is it so important that the health service is able to achieve these goals? What does net zero even mean? And why is that good for a patient?
Yeah, well, I mean, the phrase that's often used, and it was used yesterday, I was at Westminster and someone mentioned this, and it's a brilliant phrase, but the climate emergency is a healthcare emergency. And what that really means is, because you're right, it's not always obvious to people, but when we've got increasing temperatures, cardiovascular disease is going to be exacerbated, respiratory disease is going to be exacerbated by these rising temperatures. Hospitals have heated up, we've got problems with the IT systems. When the planet gets hotter, it impacts the infrastructure, the patients. This area, obviously, Hull, where we're in today, massively impacted by flooding.
Yeah.
Has been a few times. People will not be able to access healthcare services when it floods. We've just had the wettest winter on record. I was just listening to a radio show yesterday. We're probably going to see similar things this winter. I mean, this summer we've had some decent weather. It's been fairly, hot and, not too extreme. We've had lots of rain in summers. I mean, I'm a flood warden in the area that I live, so I'm kind of well attuned to the different ebbs and flows of the weather. But yeah, this is the reality. This climate is going to impact on people's physical health.
Yeah.
It will impact on their mental health.
Yeah.
And it will prevent access to services when we have these extreme weather conditions. And as I said, it could impact on the buildings and make things go down. So it's a complex web.
It's making that connection, isn't it? Because that's the thing. Because I always think whenever we have like a particularly hot summer in the UK, and last year we had the hottest, we had like the 40 degrees.
Yeah.
It was ridiculous. For the UK, that was ridiculous. And the UK should never be at that temperature. But whenever these things happen, of course, all the news reports that go out say, look, if you're an older person, underlying causes, be aware because this is going to have a knock-on effect, And so we hear this stuff. So, there are these warnings that are going out which are becoming more and more frequent. And as you say, because the climate is shifting, we are having particular wetter periods, particular hotter periods. And I think the difficulty is trying to make that link between climate change, net zero, sustainability, all these words aren't just kind of some fluffy thing that's out there that says, look, hey, we need to save the planet.
Yeah.
As important as that is, it's actually, this affects you.
It will do.
Your children, your grandchildren,
Yeah.
and if if your city's under serious flooding and stuff like that, the ambulance can't get out to you.
Yeah, exactly.
These tangible connections.
You're right. There's so many that we can kind of go off on. If we think about something like air pollution, well, air pollution is caused by fossil fuels, isn't it? That's the reality. When we look at where we are, we're not a stone throw away from a major road. We've got diesel trucks up and down that with schools close by. People are breathing in particles day in, day out. That is killing people today. We know that. We've got to transition away from fossil fuels, not only for helping reduce the emissions, but for things like air pollution, which again, when we've got ill health, then we're putting pressures on the health system. We're using more consumables. It's this real kind of vicious circle that we've got. So, it is all interlinked. It is a complex web. And hopefully we can help people try and understand those complexities. And as you said, try and shift those views and make people really, understand why this is important and why we need to keep on this journey, which I think we can do. I think there's some great work that's happened and hopefully we can continue to get these messages out.
Yeah, and I think there has to be an acceptance that there has to be a little bit of disruption, a little bit of pain to that as well. It's not easy to transition to a different way of living, a different way of working. You can make small incremental changes, but if you're going to really start making radical shifts in the way that we do things, the way the health system runs, all of these kind of factors, then there has to be a change in mindset in how we do that. And you was talking about air pollution there, and I live next door to a primary school, and I tell you, in the morning, the school run, it's just pandemonium down there. And like all of these cars, and they all arrive nice and early to pick the kids up, and they all sit outside with their engines running and blah.
Yeah.
And I always said, if there was pink smoke coming out the back of those cars, the street would look like candy floss. You would see it. It's because you can't see it. You know,
absolutely.
And I think those kids who are there, that's all they're breathing at that moment. For that half an hour of that day is just smog. So really, one very simple intervention would be don't have cars near schools during the peak hours. Which seems like a very obvious thing to do. With that comes an element of disruption because then you have all the parents going, oh my gosh, I've got to get to work, all that kind of stuff. But it's those little things. So I guess my question is, do you feel in what you're doing, are you fighting a bit of a battle, do you think, to move things? Or do you feel comfortable in what you're doing?
I love this example because it's really close to my heart as well. But let's get into the world of innovation then and that particular topic. So you're right, we've got a few things going on there. We've got behaviour change, we've got education. So that scenario that you've just given will not be uncommon across the country. Sure. Parents are probably parking outside the school for a few reasons. They're probably rushing as well to work. Sometimes, people are, I've got to drop my kid off, People might not be aware actually just how damaging day in, day out are those particles that your child and their friends are breathing in. They're probably just not aware of that. And then obviously there's I've got a diesel car, I can't afford an electric car, I can't transition over. So there's a lot of things going on there. So let's have a think about innovation. I mean, I quite like your suggestion as well about pink smoke. I mean, let's think outside the box.
That would be a good radical stunt.
Exactly. It would be a good marketing stunt.
Yeah.
But there's a company that I'm actually working with, Road Vent Pollution Solution, whose innovation is to suck those fumes out of the area. So it's a vent that goes into the road system. Those kind of innovations probably need to be outside schools, because we're not the reality is we're not going to be able to change that behaviour overnight. We're not going to be able to get people to transition away from diesel, petrol cars overnight. So innovation like that could be a really good solution. The other thing that obviously we've been sort of talking about as well is nature. Nature will take those particles out. We know that. There's hedges that you can plant that will take those particles out. So we just need to get that green infrastructure.
And why aren't we? What's stopping that?
Again, I think education. That does this thing work? Money, who's going to pay for this thing, and why should we bother paying for it? Because again, we kind of kick the problem down the road, don't we? And it's like, well, okay, those children are breathing in harmful particles, but we might not notice the asthma for a few years, but it will happen. Yeah. It might happen in later life. We might not fully understand the cardiovascular, the cancer risk, the long-term risk. We might just not fully appreciate that in the short term. So funding for those issues becomes a little bit of a problem. We might not be aware of the innovation that could help solve that challenge. These road vents, people might not be aware of that. So there's an awareness about the innovation, there's the funding issue, but these are insurmountable challenges. We just need to have the conversation about this is not acceptable and we need to address it. And as I said, that solution we put in today might not be the one that we use tomorrow, but we've got to keep improving. We can't accept that people breathe.
It's just like, I think the thing is, and I'll move on from this in a second, but I'm just thinking in terms of the everyday person. It's that sort of out of sight, out of mind thing. Everyone's so consumed with their own lives, aren't they? Every single day. And of course, in a way, it doesn't help that you kind of get these shock factors that are coming across. Oh, it's the hottest summer of this, and this is going to happen, and climate change is going to destroy us all, and all of these kind of narratives. And I think the problem is so huge and so out of mind-blowing that the everyday person just thinks, what can I, look, I'm just trying to survive tomorrow, I can't deal with that, and so I think there just needs to be more of that nuanced conversation about, one, in terms of behaviour change, what can you do? Why does this matter to you? And how can we help you do that? But I think on a larger scale, and I guess this is what the Health Innovation Network is all about, it's about trying to connect those dots across the regions. And, if there is simple solutions, like saying, look, we just need more hedges down residential streets or whatever. Okay, well, that sounds very simple. And so the average person, again, would say, well, okay, so put some more hedges in. What's the problem? And then beyond that, there seems to be all of this, stuff, bureaucracy and planning and money and who's responsible, who should plant those hedges, who should pay for it, should there be some legislation for it? It goes on and on and on. And it's like, how do you just get things done? And so for you, how do you get things done?
Well, it's not always easy, is that? I mean, I think probably going back to that feeling that you've described from me, I ebb and flow through this, and I work in this agenda. So I can often feel, massively passionate, excited, enthused, and then other times really disheartened and why bother? I will sit at home thinking, why am I tearing that packaging apart and putting the different components into different places when I'll then look out of the window and see massive, construction projects with concrete jungles and, all of that dust and dirt, and just when I look at global affairs and the things that are happening, well, obviously I'm not going to go into it, but you can imagine the things that we see in the world, it just makes you think, what am I doing?
Do you remember before, I mean, it was probably going back early 90s, maybe the 80s now, I don't know, I'm trying to think, but there was a period where they were saying about turning off your TV and things like that. And it was like, turn off your seat, save the planet, save electricity, blah, blah, blah. And, the kind of narrative from people was saying, you must be joking, you're worried about my TV being on standby and whatever.
Exactly.
And I guess you hear it every day when they say about the UK, and they'll say well, have you seen what they're doing in China? Have you seen those are the sort of narratives.
Exactly.
And so I think you almost have to reduce the scale of the problem and individualize it.
You do.
And from your point of view and what your colleagues are doing, is that what are you trying to find almost regional small pilot solutions that can possibly expand Or are you trying? Are you trying to drive vast change?
Yeah, I think probably it's a mixture of both, actually. We want to see things spread and adopted at a national level, of course we do, but sometimes you have to test locally. There's still that kind of requirement that maybe some local areas have differences. So, for example, when I was in London yesterday, that's very different to the city of Hull where we are. It's very different to the rural North Yorkshire where I was the other week. So, there are differences, but, so there might not be always a one-size-fits solution, but it's not an easy task, but we've got to keep raising the profile of net zero and try and make sure that people do understand that maybe some of those smaller behaviours are important. We don't want to waste energy, consumables, resources, our effort and time. So if we can keep thinking about that, we will have those small incremental changes that will add up. So I don't want people to be disheartened. As I said, I ebb and flow, but it doesn't mean that I don't continue to try and do my bit at times to, as I said, as daft as it sounds, I don't like travelling to things when I think, why would I go to that place? Sure. I mean, of course, it's brilliant being able to speak to you face to face, but equally, I could talk to you on Teams if we were just doing business, and we'd probably still have a decent discussion.
Sure.
So, I try and sort of think, well, I'm limiting that. Yesterday, obviously, I got the train down. I wouldn't have driven down just because but then you try and walk a little bit. So I was enjoying walking around London yesterday just to get that, get me moving,
I'm just thinking of because at a local level, so in our region, we have quite a high issue of vascular disease. That's a big issue up here.
Yeah.
Now, there's lots of ways to challenge that. Typically, what is being tackled with medication. That's essentially how, metformin and all that kind of stuff. But really what you need to address that is a behavior and a lifestyle change. That's fundamentally what needs to happen. But I've always said, and when I started doing my PhD research on this, it's like, how do you change human behavior for to make things more green?
Yeah.
And it came down to some fundamentals of people need the capability, the opportunity, and the motivation to change behaviors. And there's multiple facets that affect that. And if you shift each of those bits, you'll see the behavior shift move. But you can't just say, do this or do that without taking a measure of, is it possible for them to even act in that way? And I know this is sort of on an individual level and we're sort of drifting off the health service, but I think there's a knock-on effect because the health service is obviously impacted by people that are suffering with these diseases and problems. So there's an element of being able to help themselves, but we've got to be able to enable them to help themselves.
We do.
And I think there's a crossover between those two parts. So I think whilst the health service is going out there and what you're doing is great because you're sort of saying, look, how can we address this? What's going on? How can we harness it and do things with it? But does that need to be it needs to be in collaboration, I guess, with local authorities,
of course it does.
Government leaders to get people to understand that and adopt different lifestyles.
I mean, you sometimes you really can self-combust with the complexity of what needs to happen. And there's that phrase like paralysis analysis where sometimes you don't make a decision just because you're thinking, what the hell should we do? But again, if we talk about individual behaviour, I mean, this morning I have been in cold water therapy because I enjoy watching podcasts about why is that beneficial to me, my cardiovascular health. So even though it was freezing in my head, I was thinking, but this is good. It's getting the blood going. I know it's got benefits. Same like a plant-based diet. I was eating some nuts and seeds yesterday on the train on the way back. Brilliant sort of quick local snack that's healthy, that's good for the planet. So plant-based is obviously seen. So sometimes we just need to educate people. I've been really interested in nutrition for many, many years. It doesn't mean that I don't eat dairy. It doesn't mean that I don't eat meat. I reduce my consumption of those things. I always have done. But you can see then why people are starting to really say, you know what, a plant-based diet, actually, it's not only good for the planet, it's really good for you as an individual. So it comes down to education. I was listening, I've forgotten the lady's name, brilliant health professional, doctor in London, just talking about plant-based diet. There's a bit of a movement down there. But, if we all want to live longer lives and be able to see our grandchildren and not be hindered by poor health in later life, be able to move, which I certainly do. I want to get to the age of 80, 90 and to be still having a good, we've got to be able to inspire people to have that vision, to want to do that, and then to go on to achieve that and think about what do I need to do to achieve that? Well, you need to move, You need to eat well. And so, again, it comes down to a bit of education, like I say, a bit of self-ownership. But the other thing that you've mentioned as well is maybe where do the local authorities, so the area that I live in, the infrastructure for cycle paths is not brilliant. There's a brilliant Hull to Windsor railway line that I used to bike down, and I used to love biking down it when I went to work, and I worked in Hull. And again, I look at things like that and I think with a little bit of investment, they could be even better than they are now. So sometimes we need the infrastructure to inspire people to want to be able to keep well, to move well. And as I said, if we take them examples, then you're not driving in your car. So we need good public transport infrastructure, good personal infrastructure.
I'm with you, and but I suppose to counter that slightly is that they rolled out the cycle lanes in Hull where we are, and there was such a backlash to that thing, and fundamentally, sort of saying, well, now it's even worse, the traffic. I mean, it's like, well, no, because there's just too many cars on the road. Fundamentally, that's what the problem is. But so half of me sort of saying, absolutely, we're a flat city, make it a cycle city. Why couldn't we be like the folks across the water? But the danger is that, again, going back to that capability, the opportunity, how do you get people to walk out the front door in the morning, not instinctively get into their car and actually take out a bike? There's an element of shift that you need to push in that world. And maybe does the health service and, like, I don't know, GPs and primary care and things, do they have a role to try and influence that, almost like prescribe that, I guess, like social prescribing in a way, here's what you could do to improve your life, and as a doctor, here's why I think you should do this,
Yeah, you're right. I mean, again, I think we've got to make sure that we all don't sound like we're preaching to people, because like you said, it's sometimes very hard to not make those decisions, those behaviours. So again, is travelling in a car a bad thing? It is when it's a fossil fuel car. When we start moving to innovation and getting more electric. Now, I know electric cars, there are problems with those as well. I get that, the precious metals that go into things like the batteries, etc. I understand that. But, the use of a vehicle to travel from A to B, we need to keep innovating in, so that isn't having an impact on human health and planetary health. Now, that doesn't mean we're there today, but if we can have that vision that that's where we want to be, then I'm sure we can achieve it. There is something about change behaviour. Again, I know that there are GPs, nurses, other allied health professionals jumping on their bike to go and see patients, or maybe using, again, to come back to some of the innovation that I'm involved in, there are companies that can help when we're travelling to that patient's home and those different appointments. Are we doing it in the most efficient way possible? Because if we think about something like Google Maps, for example, we know now we've got data that can really hone in. You want to be travelling in this direction through this road. You want to be keeping away. So this is where data and innovation comes into it as well. So it's not necessarily that travel's the problem. It's the way we're travelling at the moment is the problem. And we've got to try and keep innovating in those areas to improve that. And as I said, we've got e-bikes, there's health professionals using e-bikes, e-cargos to take blood samples around the hospital sites and things like that. So there's lots of things happening, but they're only happening because health professionals are saying, well, actually it's happening for two reasons. One, the NHS was the first health system in the world to put legal targets to achieve net zero, which is brilliant. So we've got the legislative and the policy direction. But then you've got the professionals on the ground, the health professionals wanting to drive that as well, and obviously the managers. So, movement of things, of people, of goods, is a problem when it's fossil fuel derived.
And I've always sort of said on this, like, because typically when we talk about climate change and things like that, things like air travel comes up all the time, flying on planes. Well, just don't fly on planes. I think that's completely the wrong answer. I was like, aviation is a miraculous human innovation that's enabled us to do this incredible things. Don't stop flying. But if you can get an object that's heavier than air to fly through the sky, then you can sure find a green way to do that. And that has to be the approach, doesn't it? Don't take away what humans have achieved, make it better, improve it.
Absolutely.
We've recognised the problem. And I guess it comes to the same in the healthcare system. And it brings us nicely on to technology and digital health. We're clearly in a revolution of digital. The world is vastly changing. There's no doubt about it. ultimately that's going to have an impact on the healthcare system and how it operates, how it reforms. What are you seeing how are you seeing it being affected by the digital world?
Yeah, I mean, there's lots and lots of areas. I've often said to people, some of the innovators that we work with, probably a big chunk of them are of a digital nature.
Yeah.
AI is obviously a really hot topic at the moment. I think it's a great topic. I think it will bring net zero benefits. Obviously, we just need to help people navigate that. So, for example, let me start picking on a couple of examples. And I was listening to the Minister for Science and Technology speaking, Peter Kyle. He gave a really passionate personal example. Sadly, his mother died before her 80th birthday. And the reason she died, in his opinion, was because her lung cancer wasn't picked up 3 times.
Right.
And a company that the Health Innovation Network have been working with, Behold AI, use AI to find lung cancer within 7 minutes. And he firmly believes that if that innovation had been adopted and is more widespread, that we wouldn't be missing things like, lung cancer. So AI in diagnostic tests has a place. AI in productivity has a test. How can we make people more efficient in what they do? I use it in my role for information retrieval. The world, as we've just been describing, is really complex in net zero and in other topics to do with health. We need people to be able to find information to help them be empowered and do a good job. We're not going to be able to do that just relying on the human brain anymore. I just think it's impossible. So I think AI is a really good topic. But then if we just think about like some of the more, well, like you say, video consultations, they're a bit more widespread. I've had video consultations. It works. Why would you want to go and travel all the way to see someone when you could just have that initial face-to-face?
Sure.
There are digital platforms that, again, can use the camera. Another one that I'm really a big fan of, and I was just looking at their website yesterday, actually, but you look into the camera, it's called a company called Lifelike AI, and it will tell you if your blood pressure is high. We know that hypertension kills people.
Yeah.
We need it to be accessible. Not everyone has got access to a cuff and a BP machine. Not everyone's got the time to go and check out their blood pressure. Some people, because it's called the silent killer, might not even know. To be able to look into your camera and, brilliant. And that record push instinctively into your...
I have to say, I've used, not that particular one, but there was another company that was doing something similar. And you look into the camera and it measures the blood flow. And it is incredible because it can give you like so much data about your blood pressure, but all sorts of other things that are going on inside your body by monitoring your blood. So, the advancement of just the smartphone and these apps that power it, just incredible. And I suppose it's been able to harness that power at a much larger level, so the capability in terms of, say, like screening and things like that. I was speaking to a radiologist on a podcast a few months back now, and she was sort of saying, look, we can detect with almost 100% in mammograms now very, very quickly what's going on, what most doctors can't see because it takes them hours and days to find this stuff.
Lovely.
You can do this in a few minutes. That's great, but then it's like, how do you get that rolled out? How do you get those screening tests rolled out in supermarkets and whatever and get people routinely going in and being scanned and given results? As
a bit of a shameless plug then, I'm going to say that is the role of the Health Innovation Network, to find innovation like that, because the company that that example you've just given, I can think of similar companies, so it might even be one that we've worked with in the past, but we need to find that innovation. We need to test it. Does it work? So some of that, again, going back to the funding, I'm doing a piece of work next week on net zero research funding. There is money out there to test and trial things. There's probably not as much money as we'd like to see for the adoption of innovation, but let's just make sure that we know things work. So let's try and find some research funding. When we've got the evidence, then it becomes a case of let's try and roll that out. Again, just to give a live example, a company that I was working with using the smartphone, you can scan your urine with the smartphone and it will test you if you've got abnormal ACR levels, which are a precursor to chronic kidney disease. I was lucky to help that company roll out. We started in this area in Hull, in a GP practice in Hull. It then went out into West Yorkshire. It then went out on a national level across England. It was a company called Healthy.io. They were able to do that because NHS England provided digital accelerator funding. So this is great. And I always remember at the time when I was involved in that project, it wasn't just that I liked that innovation. It was the concept of getting people used to the idea that your smartphone actually might be used for other things in the future. And it can do. Just to wrap this into a bit of net zero as well, this is it. We're wasting time and effort by dragging people in or not picking up people's diseases early.
Yeah.
And then that comes with a whole host of problems. So in terms of preventative health, that's why we want to see some of that digital innovation.
Yeah.
Because if we don't detect early, if we don't do this efficiently, we're going to waste thousands and thousands of hours and resources and consumables doing that. So there's obviously a net zero benefit to that, which we're starting to try and help people think about and quantify.
Yeah, and in terms of net zero and your specific role and the areas you're working in, what's exciting you? What are you seeing out there that's driving green, sustainable movements across the health service? Is there anything that's really peaking?
I'm really privileged that I get to see lots of different areas, and I'm going to have to try and pick some ones that are kind of live in my brain.
Just in terms of theme, just in terms.
In things. I mean, I've just ran a session with NHS England last week where we looked at innovation that can help the NHS estate, and actually that is things like how can we generate energy on site.
Yeah.
How can we store energy on site? How can we process waste on site? What other innovations there might be as well within the estate portfolio? For example, travel comes under the estate portfolio. So we talked a little bit about travel. So that is obviously a big area. The NHS estate and the infrastructure is massive. And, if we take a concept like on-site processing of waste, this kind of excites me from a few perspectives. But at the moment, what we're doing is saying, right, here's all our waste, take it away off site and burn it in high temperature incineration units. Yeah. So there's a waste there because those materials could be reprocessed in a more streamlined logistical way. So if you process it on site, you can shred it, you can decontaminate it, you don't have as many lorries coming backwards and forwards collecting it. You can, in theory, do something with that byproduct waste, turn it into other products. So obviously the kind of, a lot of the gold standard is that let's reduce our consumables, let's not use as much. Obviously that's brilliant, but we know ourselves there are going to be things that need to be used. There are going to be things that are contaminated. So how can we apply innovation like on-site processing and different decontamination innovation to deal with that? So that is quite an early concept. That doesn't really exist in the health system at the moment, but the policy is there to say, look, we think this is a good idea, but we need people to start testing it. Maybe find out why it doesn't work or where it fails or where it needs to be improved. That is what innovation needs to do. And it's not always easy for people to move away from wait a minute, we just get that company to come away and take our waste away. So that's one area. I'd say generating energy on site is a brilliant example. Yeah. Again, there's a company that I'm working with that, their wind turbine is a bit smaller, a bit more compact. It's not a big, huge wind turbine. Obviously, again, wind turbines are very pertinent to this area when we've got a big wind turbine factory down the road. So those areas interest me, but if let's think about the patient as well. How can we improve the lives of patients? How can we make pathways slicker and quicker? I've just done a piece of work to quantify the impacts of wound care. If we get people's wounds healed quicker, we will have a net zero benefit. And I did some calculations on that. And, just this particular example, it was like 370,000 kilograms of CO2 could be saved, which was the equivalent of about 280 cars driven on a road a year. Now, those numbers are a little bit meaningless, but what was really useful is the people involved in that project really like to see some quantification because then it helped them feel good about the work that they're doing to improve patients' care and improve the wounds. Digital really interests me. I want people to be able to sit at home, like with a musculoskeletal condition. My boy's hair is growing at the moment, probably doesn't need anything at the moment other than just sort of very sort of conservative treatment. But there are apps that you can look at which will check your range of motion. I think many of us will experience a musculoskeletal condition in our life.
Sure. Every day.
Exactly. We don't want to be dragged
It gets worse, folks.
Yeah, and exactly. And physios can't deal with that amount of demand. So we need to think about what digital innovation out there. Another great company that I've worked with over the years, but making consent for your surgical treatment electronic. Sounds really obvious, but a lot of it is paper-based at the moment.
Sure, yeah.
And when you digitalize something, you can actually make it more accessible, different languages. You can allow the patient to read it in their own home. You can put links to lots of videos. What will that surgery do to me? Do I definitely want that surgery? So you can have a real informed consent. So there's things, again, like that, they're not setting that innovation up to be net zero, but if you think about all the paper that'll be printed and wasted by not having, innovation like that. So there's lots of areas, but yeah, the infrastructure, but patient pathways, improving patient lives, we've got to think about that first and foremost.
Yeah, I think what's cool about the net zero thing and being more sustainable is you can literally connect it to anything.
Yeah.
So you can say, by improving healthcare or improving, say, preventative health, people maybe are more active and they're more moved about. There are less visits to the hospital. There's less paperwork that needs to be done. There's less time on the surgery.
Exactly.
The lights need to be on less here. Whatever. You can go on forever. There's so many connections to it. And I think it's that ecosystem. And also in terms of the economy as well, is being able to, if people are more healthy, they're more active, they work more, they're out and about, they're spending more, everything's stimulated more. And there's less reliance on them having to be in a hospital or requiring care or sat on a waiting list. All of that stuff naturally has an economic benefit, but also has a climate benefit because, essentially it's less resource in all the capacities you've just talked about.
Yeah.
So as the NHS evolves, or as the health service as a whole evolves, how do you see the Health Innovation Network evolving? Do you see this growing out to be across more areas, becoming a bigger part of the health service? Like, what's its role now in compared to the health service? And do you see that becoming a more significant role?
Yeah, I mean, you've mentioned a good point there, because economic growth and economic prosperity is actually really important to the Health Innovation Network as of now. It's one of our key metrics. So we've managed to help companies leverage £2.6 billion worth of investment since we've been working with companies. We've managed to safeguard 10,000 jobs, not just safeguard, but create 10,000 jobs. So economic prosperity and economic growth is absolutely vital to a healthy society and population. So, you're right. We need to kind of keep driving that. We need to think about, again, if we take like the green infrastructure example, we don't have green walls all over our cities. I mentioned this yesterday when I saw one, and the response I got from people was, they're really expensive. Well, then we need to do something about that, or we need to find the investment to help drive that. Because if we said, from a policy perspective, that this is important and we want green infrastructure everywhere, that would create jobs.
Yeah. Do you know what's interesting as well? Because the barriers always go up, don't they? And it really does frustrate me because it happens across, not just at government level, but just across people. As soon as you say, could we do this? Immediately the response is, we can't because this, that, and the other. And often that implication is money or finances. Mm-hmm. Who's going to pay for it? Whose responsibility is it? Essentially pointing it's somebody else's problem. But I always think, but what's the cost of not doing it?
Yeah,
and this is something that drives me nuts. They say it costs X amount of billion a year, the NHS spend on this and they spend on that. And then you roll out a thing, you say, oh, look, we've got this new piece of technology that now does this. And say, well, how much is it going to cost? I say, but how much is it costing curing the problem? And actually, yes, there's that initial impact. And I was saying at the start of the podcast, there has to be some disruption. Yeah. There has to be some investment. There has to be some time. Things have to shift a little bit. But actually, the long-term outcome of that is a much better, greener, more economic, healthy transition.
Yeah.
And, we need to get to that stage, that longer-term thinking.
Yeah. Well, again, you mentioned some brilliant areas as well. I'm really interested in carbon quantification, but actually that needs to go hand in glove with economic evaluation and quantification. So we do a lot of economic evaluations in the work that we do, and trying to now wrap in the carbon, the net zero benefit. But people need to understand, like you said, what are the costs of not doing something? What are the benefits? I don't think we're brilliant still across as many areas of that quantification that we need to be. We absolutely need to be able to paint that picture of why is this a good thing to do, what the benefits will bring. And you're right, there's some sort of perverse incentives. Sometimes we make those very quick decisions. There's a phrase in the NHS that's used at the moment, like value-based procurement. But how can we make sure that we don't just buy the cheapest thing as of today? How can we actually make sure that we've said, I know that product, let's say, for example, costs £1, but we've not considered the logistics, the waste of that, and all the other things. So if it was a reusable product, let's say, that costs £3 and a single use costs £1, but we've not quantified the extra part of that, cost. So we just need to get a little bit smarter at the quantification of the benefits. So I think you're absolutely right. That is a kind of key area.
Yeah, I mean, it's interesting. The word value, we use this a lot in the innovation world, and we say value can mean lots of different things. Value isn't instinctively it's not just money.
Yeah,
value is data, resource, time, life quality.
Yeah,
I mean,
yeah,
you could measure
yeah,
value in a
yeah,
thousand different
you
ways,
can.
you know. And I think we just got to get to that sort of thinking, you know, in terms of innovation, climate change, net zero. All of these to the average Joe probably sound very out there and fluffy, but
Yeah.
it affects their everyday lives.
Yeah, yeah.
And we've kind of got to get that built in. The other interesting thing, I think, the reason I enjoy having you on the show today is that there's a talk about. There's a lot of what's the word? It's like negative talk about the NHS all the time. It's really strapped. It's creaking. It's not coping very well. It needs reform. All of which is true to an extent. But actually, this stuff is happening because you're testament to it. You're out there, and the health service is actively trying to future-proof and do things and change for the long term.
Yeah.
And I think maybe that needs to be talked about more.
Of course it does. Which again, you know, I was obviously really excited to come on this show today. Shifting views, you know, absolutely. We do need to shift views. We need to show people what's happening. You know, there's still a bit of a lack of awareness of some of these great projects. There's a lack of awareness of what people are doing, so we're not joining it up as much. We're not maximising our efficiency. And again, that's why I mentioned like AI. I think AI can help people do that. But yeah, we do need to sort of shift views a little bit. Again, sometimes in the world of innovation and disruption, you might have to try things that people aren't always comfortable with. I often say things in my job that I think don't always go with the right narrative, but it's what I believe in. So I try and be authentic to what I genuinely believe in. So for example, carbon offsetting, I'm a big fan of. You know, I often think like carbon offsetting, we should knock that phrase on the head and call it investing in nature. We really need businesses as of today to be investing in nature. We probably need more policy of investing in nature. We see some of that. There's a brilliant collaborative project called Nature North, which is trying to do that. But, you know, we won't be able to be net zero, which is basically, we know you're going to have some emissions, but we need to sort of be able to balance them a bit without things like nature. Obviously, there's technology coming on board and carbon capture, but nature, you know, blows it out the water in terms of what it can do to help us on that journey. So the reason I'm saying that is a view that often can be a bit contentious with people. No, you don't want to be carbon offsetting. That is just, you know, you're just getting away from the problem. And I get why people say that.
Yeah.
But we have to shift views and we have to think differently, even if it's just to have that honest debate to be able to talk about those problems.
Well, it's the danger, isn't it, of I guess what they call greenwashing.
Yeah.
Yes, companies say, well, you know, technically
Exactly.
we did this, but actually we offset it by doing this or whatever. And people go, well, okay, that's essentially you're just manipulating numbers, you know, and that's kind of the narrative that comes out. But actually, a lot of people are genuinely trying to offset the word, you know, they're sort of, look, we do emit a lot of this in our infrastructure or whatever it is we do for a living. And we try to counter that by doing these number of things. And so I think a lot of businesses and organisations genuinely are trying to do that, you know, and I think the health service is probably trying to do that as well. Look, you know, what's the most efficient way we can do this? Even if cynically it's just for a financial benefit, that's great because the knock-on effect to green and net zero is there. So who cares? As long as they're achieving it, you know, there's an element of that. But I just think there needs to be it needs to be more. It just needs to be talked about more. You know, this stuff is happening, and when we talk about it from a medical point of view, you know, so every time they bring out some new kind of wonder drug that says it's going to now slow down Alzheimer's or it's going to do this, everyone goes, "God, that's amazing." But you say, "Well, listen, guys, people have been working on this for years. This stuff is happening." And I think flipping it from that to the green, the climate side, so it's not just medical, but actually this stuff is happening. You're out there, you're speaking to these people, you're looking at this stuff, and you're saying people are working on solutions. We need to have more conversation about how we get these rolled out, how we pilot these, and more conversation about how we get more organisations coming to people like you and saying, listen, we've got an idea, we really want to try it, how can we do that?
Yeah, absolutely. And like you say, that is why we're here. We're here to support the NHS system, we're here to support innovators, we're here to hopefully influence and be an authoritative voice. That's why I was at Westminster yesterday, able to sort of try and influence the new government. What are the kind of policy levers that we need to change to be able to help the NHS on its net zero journey? As I said, we've got some really good levers in place at the moment, in so much as it's put in legislation it needs to be net zero by 2040 for the emissions that it directly controls. But there are some other things like funding. You know, we probably do need to look at how can we test and trial more innovation? How can we just build that evidence base? So, you know, there are pots of money for research, but we maybe need that more translational money for, right, we're going to put this into practice and then we're going to spread and adopt it. We know it works. So yeah, it is. It's a good topic. It's a complex topic, and when I speak to people like just doing this podcast today, it makes you, as I said, you can ebb and flow, can't you? I think you can see that as well, can't you? You think, right, do you get disheartened by? Because you're right, that example you gave of the cycle lanes. It's hard to not. Sometimes those topics get emotionally charged.
Yeah,
but I think fundamentally, whether it's a good scheme or not, because I'm not that close to it, but probably principles of it are right, and we maybe just need to improve. And that's innovation.
The problem. So that is innovation, and that's what again going back to that start of the podcast. I was saying there has to be an element of disruption, because that is what comes with it. So the cycle lanes and things like that, I'm an absolute advocate for.
Good.
Yes, get more people on bikes.
Good.
Absolutely. And when they started rolling it out, I was like, yes. Great, this is exactly what we need. The problem is the communication. It's saying you just kind of build this infrastructure and then expect all of a sudden everyone to just jump on a bike and switch their lives. And it's like, no, we need conversation. Are they able to do that? Why would they do that? What's the ultimate benefit beyond saying, hey, let's save the world? It's too big for people to comprehend. How do
relate it? I mean, again, just from a personal perspective, and again, I know this city really well, but I got knocked off my bike and could have been killed on a roundabout. I got knocked off my bike on a very busy roundabout. Another car could have, crushed me, killed me, and the reality is that when you're biking to work, if that's your only form of transport, because I mean this was about 20 years ago, and at that moment in time I didn't have a car, my car was broken, so it was my only form of transport. So when you need it and rely on it, and when you realise the dangers, that's when you think, like you said, good on, more cycle lanes. And you look at other countries and think, why couldn't we have this? Why can't we have those brilliant paths that are out of the way of all traffic?
I mean, it's amazing.
Listening to nature.
I've seen all of those videos of the kids going to school in, across it in Amsterdam and places like that. And they literally do like school runs, but it's bike school runs. And it's like 30 kids on a bike. And it's cool. It's the coolest thing ever. And I'm totally for it. Do more of that. I'm absolutely for it. But you've got to get people on board with that.
You do.
Yeah. And that's where that conversation, and then this stuff that you're doing, where you're really trying to drive innovation, you're trying to get like things more efficient, greener, achieve these net zero goals, and all the knock-on benefits that you've talked about. We've kind of got to get people on board with that as well. This stuff is happening. Stuff, and we can make things better. Here's why.
I think people like yourself have a massive role in this that you probably don't fully appreciate. But we talked before about the ability to show people what's happening, but show people in a really good visual way, in a kind of modern way. We said like TikTok, Instagram. People are consuming. YouTube is my main source of information. I'll be honest with you. It's what I enjoy. I enjoy watching lots of different topics, and YouTube allows me to do that. But we've got to show people what is out there. I think about, like green infrastructure. I'm not that close to the topic, but I see cities like Singapore and I think, wow, how have they done that? Why couldn't that be Hull? Why couldn't that be Manchester, Leeds, London? Sometimes we have to show people the future and help them see that vision visually so that we then can go on and create it. And I don't think we're doing that enough. You might have a lot of written information. Wouldn't it be great if we created
well, nobody's reading a white paper.
No,
you know what I mean?
No,
this is the thing. It's like, what does it actually mean
Absolutely.
to me?
So another session I was involved in yesterday at London, we were talking about living labs, which are kind of, this concept of hospitals where we can try innovation out. And we were kind of wrangling with what could that be, so they've tested that. And actually it might need to be a few things, but one of the things I mentioned is it could be a virtual living lab. It could be just something what we show people things like through virtual reality, let's say, or visual, just video, if we keep it really simple. What might the hospital of the future, the healthcare system of the future, the society of the future look like from a green net zero perspective, from a health perspective? Let's show people that, and then let's try and find the innovation that can either help do that now, or where we might need gaps. And that's, the other brilliant world we live in. We live in a world where there's lots of things like digital twins, where we can model scenarios using data to show the benefit that brings. Like you said, what would be the issue if we don't do that? Well, actually, there's some brilliant people out there doing great data modelling work. We need more of that, so that we can help people say this is the right thing to do today. So, but I think, as I said, people like yourself, I think you can help get these conversations going, help people visually see that future world where we want to be, and then hopefully we'll go on and create it.
Yeah, well, I mean, the point of this podcast is get people like you on to talk about this stuff and just shout out, look, things are happening. here's what's happening, and here's why you should think about it. And that's ultimately what we want to do. Pete, I could talk to you forever because there's 1,000 things to talk about, but we've been going for a long time. So
Good.
I'm going to wrap it up.
Thank
but
you.
just to close it up, if people are involved in this world, so firstly, how can people learn more about what you do at the Health Innovation Network?
Yeah.
And also, if you are an innovator, you're a business or whatever, can they contact you?
Of course
How
they
do
can.
they get involved?
Yeah,
What do they need to do?
absolutely. Well, again, you know me, I'm a fan of social media, so use your social media to connect with the Health Innovation Network at a national level. Go and connect with your Health Innovation Network at a local level. Reach out to me directly if there's something that you think, do you know what, I think this can help the net zero agenda. So I'm always open to people connecting and collaborating with. So yeah, use social media, check out our websites. Health Innovation Network, as I said, is a good place to go centrally because then it'll take you to maybe your local network. I use LinkedIn a lot at the moment. Other good social
So get in
media
touch,
platforms.
contact,
Absolutely.
say hello. Absolutely. Pete, it's been really good. Thanks very much for being on the show.
Pleasure.
Cheers. Take care.
Thank you.